This session's on the Elite improvements in addition to worksheets and other things. If you look over here on the right hand side under worksheets, you'll notice that there are multiple worksheets now. The non-patient worksheet will be a scenario based. If you respond to an MVA and all occupants of the MVA say that they are not hurt, they don't want anything, at this point you can fill out this, the last name, then first name, date of birth, and then their signature. If it is a guardian, print their name there. And this is a section for comments and narrative. Basically, this is if you go to the MVA, in the past you always put in the narrative, it was like a white pickup truck, this was the driver, this is where you'd fill this information in. The reason for this worksheet is before, when you put all the information into the narrative box, we were unable to track down a patient if an attorney called or anything like that. So now this is a searchable field that we can actually go and find the patient. The AMA worksheet has been upgraded, so your name will automatically populate if you have it in place. Instead of having to fill in the box, you actually have checks. This is where the medic signs, not the patient. This is the only worksheet that the medic signs. We've added a supplemental narrative. This would be for Dr. Decker or a supervisor or someone that wants to add a narrative to a report, or if we request some information instead of doing an addendum, we would rather you do a supplemental narrative. We have built in a selective spinal restriction checklist. Instead of putting all of this information into your narrative, this would cut down on a lot of documentation. So these are all checkboxes. All the answers should be, you can click all yes, you can click all no. It should be all no, and then change your pediatric for clearance, and make sure on all your worksheets that you timestamp it and put a crew member that is filling it out. We also have an OTC worksheet. This would be the same when you were down at an event, that you filled out the little pieces of paper, print the name, what they requested, what was given to them. This is the acknowledgement that this is a first aid material only, and they are not a patient, and they would sign. This OTC can be filled out for multiple people on a call. And sign, and then fill your date, person doing it, hit OK, and then you can add another one. This gives you the ability just to have one report open at the venues, so that you can keep completing them and not have to download another CAD. And if you look at this, when you go to print it, this helps out getting all the records together. Again, these are searchable fields in case we're looking for a specific person that got a Tylenol or Motrin or anything like that. This is what your OTC worksheet will look like. It will just add an attachment to the end of it. All of your worksheets just add to the end of your record. Now, if you're working an event and you have utilized the OTC worksheet and now you have a patient refusal, all you need to do is go to the on scene, hit the number of patients on scene, add patient to scene, hit OK. And this is where you can fill out your information. For your new patient. And you can save it, fill out all the paperwork you need to fill out. Down here on the bottom left, you can toggle between patients. And what I would do if I was working an event, on the patient information that I'm going to utilize for OTC, just in the name, put OTC. And then this will give you the ability, if you are doing a patient refusal or getting ready for transport for this patient, and somebody walks in for an OTC, all you would have to do is click this, open your OTC, and then come over to the right and basically just add another worksheet. We've also added a controlled substance information. So if you choose a medication that is a controlled substance like fentanyl, it will require you to fill out a controlled substance, and basically you'll pull the fentanyl and what was the vial number, amount administered, and amount wasted. We have also added a referral and outcome tab. Would you like clinical services to review a report? Would you like a hospital outcome? If this is chosen, the MRN number will be placed right here. The box will be added soon. This is going to be a required field if you want an outcome, or if you'd like to refer the patient to the community health program. Now we have a few reminders. Make sure that you add all patients to your record. For instance, if your supervisor is on scene, make sure you add them as part of the crew member, so when we're given the CQI information back, everybody gets the information, not just the 2 people that were on the truck. Also, another reminder on your medications. If you are utilizing a push presser, and we'll slide down to here. This is just a default. This needs to be changed to whatever the dosage is, and then in your notes you can push dose pressors. If you're using the add a patient button under the scene, you will have to post each one of these patients individually. If you look over here on the right, you'll see a situation. This is what we're adding, different situational tools, which takes in multiple power tools to where it makes it easier to go through. So there's your basic airway, intubation performed, and so on. So just keep an eye on those, because those will be changed and added as we continue on. You will also notice over in the timeline, in the times, the patient contact date and time will be changed to contact date and time. This needs to be filled out whenever you actually talk to someone. So if you're going to a medical call, a medical alarm call, and somebody answers the door and says there's nobody here, it was an accidental activation, still fill out this as the contact date and time. Now, just to go over the AMA refusal one more time, I didn't spend very much time on it. I think Dr. Decker, during his lecture, is going to let you know a little bit more information about it. But basically, you see that the patient's name was added automatically, and on the bottom you will see that the incident number will be automatically put in. Make sure you timestamp it and you actually put in the correct crew member. And then these are the specific items that the patient's refusing. Did they refuse the evaluation? Did they refuse medical care? Did they refuse transport? Refuse transportation? So this is basically if you thought they needed to go to Pentab for level 1 trauma, they refused to go and they just want to go to Houston Northwest, then you'd click here. And then right here you could actually list if there's any other things that were refused. Informed consent. You have 18 years of age or emancipated. This would be parent guardian fully oriented, not impaired by drugs and alcohol. and appears to have capacity. This, I'm sure, Dr. Decker will actually explain during his presentation. Do they understand the risk and complications of the refusal? Understands that they can call 911 back at any time. Then the medic signs it, and then you hit OK. So this is the end of our elite updates. There will be more to come. We try to release them at trimester CEs. If we update any more before then, we'll make sure that there's an email and possibly a clinical notification form that goes out with the changes.